Good afternoon, and thank you for joining us for today's CMS 1500 webinar. I'm Sarah McDonald from the Stakeholder Engagement Unit at the Workers' Compensation Board. To assist with your questions today, we have several board staff from our Medical Director's Office and our Data Management and Analysis Office. Today's focus will be on the upcoming mandate for providers that you must begin submitting the CMS 1500 Universal Medical Billing Form electronically through a board-approved electronic submission partner effective August 1st, 2025. Which is just 16 days from now. As of August 1st, the board will no longer act on or enforce payment of any paper CMS 1500 bills, and payers can deny them. So converting to electronic submission is critical for providers to continue getting paid for services in treating injured workers. We urge all providers not to wait any longer, and today's webinar is designed to help you understand and comply with the mandate. We will start with a brief overview of CMS 1500 initiative, review the significant benefits of electronic submission, share the currently available submission partners, and take a look at the submission process. There will be time at the end for your questions, but we ask you to keep your phone lines muted as we'll be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We will answer as many questions as we can, but if you have questions that we don't get to today, or you think of something after the session ends, we'll be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the coming days. But before we dive into today's presentation, we would like to get some specific feedback while we have you. If you are not already submitting CMS 1500 bills through an electronic submission partner, what is holding you back? Please let us know in the chat. So let's get started. Today's presentation will largely center around critical and fast-approaching component of the CMS 1500 initiative, which is mandatory electronic submission through a board-approved electronic submission partner that takes effect August 1st, 2025. Before delving into the upcoming mandate, we'll start with some background on the initiative and discuss the benefits of electronic submission and how well it's going. We will then review available submission partners, how to register for electronic submission of your CMS 1500 forms, and review the process as well as some additional reminders you should be aware of. We will then spend the rest of the time answering any questions you may have. The board transitioned to the universal form to reduce the administrative burden on participating providers who previously had to use separate board-specific forms for their workers' comp patients. Electronic forms submission provides an infrastructure to allow the submission of data to the board in an industry standard format. Since July 1st, 2022, healthcare providers have been required to use the CMS 1500 for all workers' comp medical billing. As part of the initiative, use of prior medical billing reports, including doctor's initial report form C4 and doctor's progress report form C4.2, have been discontinued. Providers must also prominently report injured workers' temporarily impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. Please note, provider types who are not permitted to opine on causal relationship or level of impairment are not required to submit this information. Beginning August 1st, 2025, electronic submission through an electronic submission partner will become mandatory. The board is thrilled with the success of the CMS 1500 form so far. Since July 1st, 2022, more than 16.7 million CMS 1500 forms have been submitted, including 5.5 million electronic submissions through an electronic submission partner. More than 14,800 providers have submitted their CMS 1500 forms electronically through an electronic submission partner. The board provided notification of the new requirement in August and November 2024, and again in January and March of this year. We want to emphasize that this requirement is mandated regardless of office size or patient population. There are many benefits to providers, which we will go over shortly. Please note, starting August 1st, the board will no longer act on or enforce payment of paper CMS 1500 forms, and workers' compensation payers can deny them. Forms that are submitted prior to August 1st, 2025 will continue to be processed, but providers are encouraged to transition to electronic submission well in advance of the mandatory date. We will now take a minute to highlight the many benefits of electronic submission. First is faster bill payments. Providers typically get paid quicker. Next, we will have reduced administrative burden. The electronic submission partner submits the CMS 1500 to the insurer and the board. Some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. Providers will have confirmation within 7 days that their bill was accepted or rejected by the insurer. With date, timestamp, acknowledgement of receipt from the insurer, the provider is aware that they do not need to resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. Finally, no or low cost. There is a designated CPT code that reimburses providers up to $1 per transaction. Now we'll review the steps providers need to take to register for the electronic billing through an electronic submission partner. Please note, this applies to each provider in a practice who treats workers' compensation patients. The medical portal provides access to the online services the board offers, including registration for electronic submission of medical bills to insurers and the board. Once you have accepted the terms of electronic submission agreement, you can then discuss details of submission with an approved electronic submission partner, also known as a clearinghouse. The electronic submission partner ensures that the medical bill and narrative attachment are sent and accepted by the correct payer and the board. After logging into the medical portal, providers who have not already signed up for electronic submission of the CMS 1500 will see a link for Agreement for Electronic Submission of CMS 1500 under the billing section. Select the link and select the I accept button. The provider's name will be added to the listing of providers authorized to submit electronic data, which is updated daily. Once accepted, the link will no longer appear when you sign in. There are currently 6 approved electronic submission partners. As a reminder, some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. In order to ensure the integrity of electronic submission process, the board requires all prospective submission partners to engage in a rigorous testing effort. Approved electronic submission partners have executed a legal agreement with the board. For a list of approved submission partners, visit wcb.ny.gov/submission partners. Important to note, the board does not endorse any of the electronic submission partners who've shown interest in or who have been approved to provide these services. The board has no knowledge of any other aspects of the electronic submission partner's business. Thus, the board makes no representations or warranties expressed or implied as to any aspect of the electronic submission partner's business. After registering with the board, you may submit the bill and narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit a paper CMS 1500 form to certain, but not all, electronic submission partners who will then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS 1500 form must ensure the submission partner they choose has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS 1500 form from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. The electronic submission partner will also transmit the billing data, CMS 1500 forms, and the narrative attachments and the insurer's acknowledgement of receipt to the board. We ask you to please keep in mind the following in mind. When the CMS 1500 form and narrative is submitted to an electronic submission partner, providers should not mail, fax, or email duplicate bills to the board. Providers who are permitted to do so are strongly encouraged to use the narrative template to create the medical narrative report that must be submitted with the CMS 1500 for ease of locating the essential elements of causal relationship of the injury or illness to the patient, work activities, patient's work status, and temporary impairment percentage. For those using their own template, please remember to include these elements in a highly visible location on your reports. Payment may be denied when a bill is submitted improperly. for example, not submitted electronically through approved electronic submission partner. This is very important. When a WCB case number is available, it must be populated in field 9A. Failure to do so may result in CMS 1500 not being matched with the correct case, resulting in delay of review and payment. Providers decide which electronic submission partner they want to use. Costs and services may vary. View the board's list of approved electronic submission partners on the CMS 1500 section of the board's website. Providers will have the ability to offset the cost of using electronic submission partner by using code 99080. This was previously a no-charge NC code in the fee schedule listed as special reports such as insurance forms, more than the information conveyed in the usual medical communications or standard reporting form, which may be used as a by report BR code up to a maximum value of $1. The code should be placed on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Note, a provider who currently submits a CMS 1500 electronically via an electronic submission partner can bill to offset the cost. Providers should advise MDO of payers who are not reimbursing for the offset costs such that we will refer the matter to our payer compliance unit. If the original bill has not been paid by the carrier, providers can submit an HP1 for the entire bill, including the unpaid offset. When billing for permanency evaluation, the doctor's report of an MMI permanent impairment form C4.3 must be attached to the CMS 1500 as a medical narrative. If you send a separate C4.3 form to the board, it will be rejected. If there are more than 6 line items for one date of service, you may submit multiple CMS 1500 forms together, with the total charge amount appearing only on the last form. Be sure to enter the information correctly on the CMS 1500, including payer and employer detail as indicated on the requirements page of the board's website. If a board case is a apportioned case between carriers, you would need to submit a CMS 1500 to each carrier and bill them at the percentage for each carrier. If the apportion is a percentage for different cases, you would submit a CMS 1500 for each case and carrier for their percentage. If a submission partner is denying submission because they don't have a WC case number, if they are denying because they do not have a Social Security number, or if submitted bills are not getting to the injured worker's case file, please advise MDO. The WCB case number and Social Security number are both optional fields, so bills should not be denied by the payer for lack of either of these. Additionally, submission partners are required to send the electronic bill to the board as well as the payer, in keeping with their agreements with the board and providers. If you submit a paper CMS 1500 bill on or after August 1st, 2025, the payer will not send you payment, but rather an explanation of benefits or explanation of reimbursement references, CARC 16 and 34 codes, which indicates your bill was not submitted electronically. In order to be paid, you must resubmit the bill to the payer electronically through an approved electronic submission partner within the statutory time frame within 120 days from the day medical care was rendered. We would like to share some other news of interest related to billing. On January 6th, the board issued new guidance to payers to reduce improper objections to medical bills. The new guidance was also published on the board's website, which includes when not to file Form C8.1B, a list of reasons that cannot be used to file form, or when Form C8.1B is needed, a list of requirements for proper submission of the form. Reminder, earlier this year, the board created a new medical billing dispute section of our website to assist providers and payers with the dispute process. The site details documentation and other requirements for common scenarios. You can visit the link on your screen for additional details. For more information on the CMS 1500 form, including a list of electronic submission partners and discontinued forms, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative, and the email address is cms1500@wcb.ny.gov. As a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates, the same ones our external stakeholders do, by hitting Get WCB Notifications on the bottom of our website. Thank you for taking the time to learn about CMS 1500 and all the benefits that submitting electronically offers. Before we take the time to answer your questions, please take a moment to let us know in the chat if you're not already submitting the CMS 1500 electronically using a board-approved submission partner. What is holding you back? Please enter your response in the chat. And now we'll take the rest of the time to answer your questions. You may hear a brief silence as we take some time to review the questions that have come into the chat, but we will rejoin you again shortly.
Hi, this is Dan. A couple questions out there regarding carriers that are not currently accepting electronic. We are working with the electronic submission partners that are board approved to get these carriers that are not accepting electronic currently to accept electronic. There are very few that we're made aware of. If you are aware of some that are currently not accepting electronic, please send those carriers over to our CMS 1500 website or email address, and we'll try to work with it, getting them to accept electronic. Our electronic submission partners do have a way of receiving provider bills, submitting it to the non-electronic carriers, but still submit it to the board through the electronic process. So if you do come across that, please work with your board-approved electronic submission partner to make sure that they're submitting it both to the carrier and to the board. Now, we also see some questions in regard to payer IDs. The board doesn't oversee a list of payer IDs. We also recommend that providers contact your board-approved electronic submission partner to identify a particular payer ID for any carriers if that's something that your electronic submission partner requires. So again, try to work with your clearinghouses or the electronic submission partner that your bills are going through, and they'll be able to provide the information that you'll need.
Hi, this is Audrey Cunningham from the Medical Director's Office. A few more questions along the line of the questions Dan was answering just a moment ago. With respect to working with a submission partner in submitting your bills to the board and the payer, once you get set up with your submission partner, that submission partner is responsible and will be sending your bills simultaneously. They're required to send the bills to the Workers' Compensation Board as well as the payer. And that is also true with respect to your medical narrative or the supporting documentation. So everything that goes along with your CMS 1500, including the medical narrative, will be sent by you, the provider, to your submission partner, who will simultaneously send that electronically to the board and the payer.
Hi, this is Paula from the MDO. There's been some questions on UB04s versus CMS 1500. The UB04 is for hospital, so that would be an outpatient hospital or an inpatient hospital. DME or DME suppliers would use the CMS 1500 form. UB04 is not part of this mandate, so if you are a hospital, billing for a hospital, then that's not part of this mandate.
Hi, Hi, a couple of questions regarding the offset code 99080. So providers can use the offset code to cover the cost of submission by using the 99080, and no supporting documentation is required for using this code. However, the price entered for the code needs to reflect the actual cost that the submission partner is charging. So it's up to $1, and it should reflect the actual cost. On the flip side, if you are a payer and you are denying a bill that was not submitted via electronically, if you are a payer and receive a paper bill after August 1st, please do not submit a C8.1 for this. Rather, in the explanation of benefits, reference CARC code 16 or RARC N34 to indicate that the bill is being denied because the provider's bill was not submitted electronically. And then in that case, for you providers out there, you must resubmit any denied bills electronically within 120 days thereafter. Hi, additional questions regarding the offset code. If you are billing multiple dates of service on one bill, utilize that last date of service for the 99080. So again, if you're utilizing one bill for multiple dates of service, use the last date of service. Otherwise, the offset code is per bill. Hi, a couple of questions with respect to what types of providers this includes. So the mandate to use CMS 1500 or submit CMS 1500 electronically extends to all providers within the system, including physical therapists, audiologists, chiropractors, DME suppliers, pharmacies, dentists, occupational therapists. Just a clarification regarding the offset code. The offset code does not apply per CPT code or reference to a medical treatment guideline. It's per the submission of one bill. So that bill could include multiple dates of service, but the use of the offset code is per bill for the submission of that bill.
There's a question in regards to, is there a payer ID for the workers' comp board? There is not a specific payer ID for the board. The electronic submission partner will ensure that the bill is submitted to the payer. Once the payer acknowledges that they've received the bill, they will send that acknowledgement to the electronic submission partner, and then we'll send it to the board after they receive that acknowledgement of the bill. There's a question if claims can be or bills can be submitted through the board's web portal directly, and no, all bills will have to be sent through one of the board approved electronic submission partners, whether that's through your own clearinghouse, as Audrey referred to before, or directly through one of our board approved submission partners.
Hi, a few more questions regarding the requirements of the submission partner. So when you as a provider start working with a submission partner, that submission partner will be responsible for sending your bills both to the board as well as the payer simultaneously.
A couple questions regarding registration, how to register. On the board website, you scroll down to popular services, select the medical portal option. Underneath that, if you're registering a provider, under the provider section, you'll click the new user access and administration option. That will allow you to get to the page where you can read the overview about onboard in the portal, as well as click the register button and get that provider registered. Someone else asking about how to log into the portal. From the board's website in the upper right, online services dropdown, you must select medical portal from the dropdown. If you just hit the login button, it won't know what you're trying to log into. So you select medical portal from the online services dropdown, hit the login button. It must be a board assigned user ID. You cannot create your own. If you receive a not authorized message when signing in, it means that you're signing in with a user ID other than the one the board provided you.
Hi, a few questions regarding concerns in working with submission partners. So if you're working with a particular clearinghouse at the moment who is not a board-approved partner, I encourage you to reach out to them because that clearinghouse may be willing to work with a board-approved submission partner or it may already be working with a submission partner. A lot of the submission partners work hand in hand. So if you are working with a clearinghouse that is not on our list, reach out to your clearinghouse and see if they are already working with one of the board-approved clearinghouses.
Questions regarding the list on the board website and whether a provider shows up. One thing we want to point out is there's a column for authorized with a Y and an N. All that means is whether that provider is board authorized to treat. So they're a New York State licensed provider and went through our board authorization process. The N in that column does not mean they are not authorized to submit XML. Anyone on that spreadsheet has completed the XML attestation. When you log in the portal and complete that, it's typically within 2 business days, you'll show up on that list. If for some reason you are not showing up on that list still, you can email the CMS 1500 email and provide the provider's name and MPI. And if you happen to know the date you completed the agreement, that would help also, and they can look into the issue for you. Question what the CMS 1500 email address is. It is cms1500@wcb.ny.gov.
Hi there. We've had a couple questions in the chat regarding recording of this webinar. This webinar recording will be available on our YouTube page and our website within the next coming days. We also have another session for providers, which will be very similar to this one, but if you have additional questions or you want a refresher, we'll be having one of these next week, the 23rd.
Hi, a couple of questions as to whether the CMS 1500 mandate applies to new patients as opposed to existing patients. So this applies to all your patients moving forward as of the August 1st date, whether the patient is an existing patient or a new patient, the bills must be submitted electronically. And there was another question on the tip of my tongue here. Take a look. There's a question from an acupuncturist, and yes, this applies to acupuncturists as well, as other providers mentioned already.
Question, what happens if you do not know who the payer is yet? You do want to talk to an injured worker Every employer is required to post a poster with their workers' comp carriers. That information should be supplied by the employer when someone's injured. So the patient should have the carrier info. If it happens to be an uninsured claim, as Dan mentioned earlier, that is the one exception where you would bill on paper until such time that we either find a carrier for that no insurance case, or we establish it as uninsured, and it's then passed off to TPA, and at that time you start billing the TPA electronically. Question, if you're having trouble getting the information from a patient or employer, there is actually a free option on the board's website called Does Employer Have Coverage? So you can use that as well. It lets you search and locate coverage for employers. You just have to obviously know the name of that employer. Use an example, you wouldn't be able to search for McDonald's. You'd have to know the corporate name for that franchise, but as long as you have that information, you can actually use that free search right on the board's website, and it will give you that insurance carrier information.
Hi, question with respect to the effective date of the offset code. So the offset code has been in effect for bills submitted since August of 2024, August of last year. So there have been bills for those providers that have been submitting electronically. They were able to utilize the offset code since August of 2024. To that end, just a reminder that when using the offset code, it should be attached to a bill for service, whether that bill includes one date of service or multiple dates of service. The offset itself is billed alongside with a bill for services rendered or treatment. Thank you.
Okay, well, thank you, and thank you to everyone for joining us today. In case you missed any responses, the Q&A will be included in the recording that will be available soon. Any questions that were not covered during the Q&A can be directed to CMS 1500 at wcb.ny.gov, and someone will respond to your inquiry as soon as possible. Before we sign off, I'd like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the home page, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook, X, Instagram, and YouTube. Thank you again for joining us, and enjoy the rest of your afternoon.